So what I'd like you to keep in mind are some of the questions that you may have as we go through the morning. I also want to take the opportunity to ensure that you return in the afternoon because we have the employers panel in the afternoon. We also have more of the door prizes. So I know that sounds like an incentive, and it is. So please come back. For those of you who joined us throughout the morning, the one thing I would ask you to do is to take your coats off. Again, we're seeing a few people with bulky coats on, and it just demonstrates that you have a desire to stay as opposed to flee. So let's see if you can take your coats off, get comfortable, and now we're going to begin. So what I'll be doing is I'll be down in the audience and I'll be having a mic on me. We're going to have our panelists now start to answer some of the questions. So what I would like to do is I would like to start with, sorry to do this to you, Eleanor, but I hope this is okay. She's one of our newer panelists. And the first question is going to be focused around, again, the critical skills that we notice can differentiate IEPs in the marketplace, and some of those skills being speaking skills, etc. And you may want to relate a story that you've come across where indeed this did make a difference. So I'd like you to address the communication side of it.
Sure, thank you. One of the things that's very important when you are working in Canada in any kind of profession, especially a regulated profession, is communication skills. And most of the professions will have requirements that you need to meet in order to register to practice. And those requirements aren't there to be mean. What they are there is to make sure that your communication skills are at a level that is the same as what's needed in the profession, so that the patients that you're working with or the people that you're working with have safe care, and so that you're able to understand them and that you're able to communicate yourself. With occupational therapy or any of the other medical professions, a lot of the writing skills is very legal. So what you're writing in a patient's chart is considered a legal document. So it's very important that your skills are well done, so that when you're communicating, it is legible and it's easily understood by any other healthcare person who's working with that patient. The speaking skills, depending on which profession you're in, might be at a very high level. If you're working in a problem-solving profession, you would need to have good listening skills, good speaking skills, and be able to converse and understand what is required of you and then how to deliver. It's also important in terms of culture. I think that the presenter earlier who talked about the kinds of ways to present ourselves in a professional manner, those are really important in order to interact with the public, which a lot of the healthcare profession jobs require interacting with the public. And so it's extremely important to make sure that the way you're presenting yourself is in a professional manner, and using some of those tips can be extremely helpful.
Thanks, Eleanor. Yes, Tracy has something to add.
Kathy, if I can. Building on what you said, in any of the regulated health professions, your ability to communicate is not only necessary to demonstrate at the entrance point, but also on an ongoing basis to engage in the safe practice of whatever profession. I want to bring it a bit further when we talk about the workplace culture and norms and even ethics. When you come from somewhere else and you're seeking to work in an environment where you're going to be mixing with clients and family members and healthcare professionals and members of the public, there are going to be certain cultural norms that are expected in the workplace. So it's very important to learn about those in your respective professions by looking at the standards of practice that talk about communication. if you think about going into a workplace from where you are from and compare it to a workplace here and looking at the nursing context, I can think about things like expressing yourself as a member of a healthcare team and advocating for clients, being prepared to challenge a plan of care, for example. For many of you coming from certain cultures, your practice in your country of origin may not have prepared you to challenge a doctor's order or to challenge or advocate on the client's behalf a plan of care or a decision of treatment that may not be ideal for the client. That is an expectation of practice here, and our standards set that out. So I would encourage everybody to think beyond the speaking, the reading, the writing, and the listening. Those are the key components that you must demonstrate to become registered and to be successful in practice, but also really get familiar with the culture of practicing in Ontario and Canada and learn. Go to the websites of each of the regulated health professions to really gain an understanding of what it means to communicate effectively in a healthcare setting.
I think whoever asked that question, there's a big market out there that's emerging. It's just starting in that innovative data analytics, data understanding space. The clinical research side, I'm a little less tied into, but I know there's those opportunities. Maybe Gamma or one of the other groups has a little bit more perspective there. But analytics is definitely emerging as something that's going to be a big thing.
Is there anyone on the panel that wants to build on that? Heather.
Sorry, if I could just add to that. So he's absolutely right. It's an emerging opportunity, which means that there's not a lot of people in this space. For the clinical research, it's also a huge field, but what I would suggest to you the huge opportunity is that for the most part, companies are not willing to pay a Canadian physician salary for that work. So if you found yourself in a position where you were looking for an opportunity, by undercutting that price by a little bit, they would happily snap up a foreign trained professional in a second. And it's a huge market, and it's a large part of what we do at Quindel is analytics on healthcare trends. Ours is outside the OHIP system, so it would be the things that are not delivered by the government. So things in hospitals and the clinical research that goes along with it. If you were willing to make slightly less than a Canadian physician, they would snap you up in a heartbeat. I think it's a massive opportunity.
Thank you. That was a great bill.
So just to add to the comments that have been made so far, so the other clinical research that's happening is we now have the capabilities, because where information technology has gone, is to collect all this information. And there are large repositories, but there's a lack of insight. So what does it actually mean? And so sometimes if you are a foreign trained physician and you can look at that data and you can help to analyze the trends or what's happening, or you take a population and you can analyze it from that perspective, then you can provide insight with respect to how we manage costs in healthcare. So one of the challenges that we have in healthcare today is we have an aging population and exploding technologies. So and we have an economy that is not particularly, we're kind of slow growing. So governments are struggling with respect to how do we manage the demand that's coming as the population is aging. How do we manage this? So how do we allocate our resources more effectively? That's coming from analyzing all this data, whether it's in chronic disease management, whether it's in what services should we build for the future. And if you can put a lens, a clinical lens, if you have the clinical training, you will see information that someone like me who's trained in finance won't necessarily see. So what value can you add that enables a better decision? So it's channeling your career, taking the knowledge that you have and applying that knowledge differently. And you can be valuable, and I agree. People can't always afford to pay physician wages for some of these jobs. But it's about working in a field that's tied to what you've learned and reinventing yourself.
Thank you. Anyone else on the panel that would like to contribute to that? Nazim, did we hand you a question as well? Would that be?
Sure. So the question I have here is, there's a recent graduate of biotechnology from her former country. And she focused on genetic technology and wanted to find out how she could apply her degree. So genetics is a up-and-coming field in diagnostic technologies, right? So it's the analysis of predisposition. It's early days still. It's we're in the early days of the diagnostic testing of it and then the application to everyday healthcare decisions. So in terms of providing some guidance, I would say that there are 3 areas that she could go in. Testing, and you'd have to see if you can't work as a medical lab technologist, if that's the requirement, can you work as a technician or a scientific research person that supports the genetic testing. You can look at whether you can move into genetic counseling. We don't have enough genetic counselors in Canada today, and that's a real area of concern. So this would be, I would say, a really good place to go if you've got that background. Analytics, again, there's going to be a lot of information generated from all the testing, and understanding it and then helping the physician. Primary care physicians are not trained in genetics. They need support. So can you support a primary care physician or even a specialist? And then once the report is all done, patients have to make decisions if they're dealing with a condition. Can you help in patient counseling with respect to making this, understanding the information? So those are some of the ideas to take the career.
Thank you for that. Now, given that one of the questions we wanted to table with all the panelists, and given your respective organizations, can you now start to comment on what some of the key market trends are that would indicate to the IEPs in the room where some of their other opportunities lie? So our theme for this year was entrepreneurism, innovation. Frank O'Day talked about being adaptable and adjusting as you discover, what can be for yourself, what cannot be. So if I could have you share some of your insights around market trends that you see would be significant for our IEPs to know. And Akila, would you like to begin?
So in healthcare, especially nursing, what's happening is RNs like me are becoming obsolete. So pursuing a degree in nursing is great if you plan to go even further, to become a nurse practitioner perhaps, or to get your PhD in nursing and become a consultant. Right now the hiring trend is towards RPNs, and PSWs are still getting quite a bit of hiring, but a lot of PSWs is a great entry level if you're struggling with English as a second language. If you're trying to learn the culture of healthcare, PSW entry level is excellent.
Can you state what PSW
So
stands?
the Personal Support Worker Program